Great, thank you, Elida. So I'm going to talk very briefly about the Alaska Whammy program. This is the Health Sciences building for those of you who have not been on the Alaska campus. And this, as the main campus at UAA, is located on the traditional homelands of the Kanatna, who are the indigenous people of Nuti and the Kanik Arm. Today, they are members of the Eklutna and Kanik tribe, and we thank them for their continued stewardship of the land. The nice thing about and the unique thing about Whammy and the Health Sciences building is the fact that it brings together multiple health disciplines within one building, which is hugely important as you develop not only other professions, but particularly physicians. Whammy came out of a need for a workforce, a physician workforce specifically for Alaska, and was founded in 1971, joining Montana and Idaho at that time with Washington. We started with 5 students, rapidly expanded to 10. In 1989, it was moved from the University of Fairbanks to UAA. In 2007, we were able to increase the program to 20. In 2011, we had the privilege of moving into the Health Sciences building. And this coming year, we'll be celebrating our 50th anniversary. Like I said, it was designed to provide a physician workforce for Alaska. The pairing with the University of Washington allows Alaskan students to attend a top 10 medical school. It makes you highly competitive for residency, which is the ongoing training after medical school, and it allows you to compete within a very small class. So there's less competition for excellent resources that are available. Where do we get our Whammy students? They come from all across Alaska. So if you grew up in Utiavik, it is not a problem. If you grew up in Nome, it is not a problem. We have gathered students from all of the places listed on the left-hand side of the slide, and we do look for a significant as well as other diversity within the class when selecting the class. Med school is just a starting point, and I think this is something that people need to be aware of when they are thinking about becoming a physician. Med school is 4 years. After that, there is specialized training within a residency program. The shortest of these are 3 years. The longest, which happens to be neurosurgery, is 7 years. Many students will then go on to do fellowships, which are an additional 1 to 2 years if they want to do something like interventional cardiology. And then you find people who are practicing physicians. So realistically, from starting med school to returning to the community, you're looking at about 7 to 10 years. That said, how do we start off? Well, we start off by trying to do our class together, and we do team building exercises in what we call a retreat. This was our E2019 class. Unfortunately, because of COVID, we couldn't really do this as efficiently with our E20s, but it involves a trip into the wilderness, triaging some patients. The curriculum at the University of Washington School of Medicine is really divided into 3 phases. The first 18 months is foundations. You have some classroom work. You will start clinical medicine from day 1, and you will be in the hospitals and in primary care clinics fairly quickly.
1 minute left.
After that, there's 12 months where you do core clerkships, and then you get to go on to your other pieces. What I will tell you about this program is that it's very much a flipped classroom. You're going to be expected to come in prepared, and then what you have prepared will rapidly go into application. Clinical days, we get started off. There is all sorts of hospital tutorials that start pretty much from day 1. You will be out in primary care clinics. Special options if you want to look at Indian health or global health, or underserved populations. We encourage service learning. It is optional. but it is part of the curriculum that we strongly encourage. We do a lot of work with other programs, including Dr. Moore, who I think is going to talk to you next, who leads up occupational therapy, but nursing and PA programs. There is a whole summer research project that again gets students early on out into the communities, not only in Anchorage, but across the state. Our faculty have various research interests and our students regularly present. So I will finish with this. It's a top 10 medical school, highly competitive. We have a small class size. And there is some fun involved as well.
Thank you so much. And next we will be hearing about the Doctor of Pharmacy program with our very gracious Zoom host, Chris Jackson.
So hello, everyone. So it's really great to have everyone here. I am taking Tom's place real quick because, you know, COVID does hit close to home sometimes, even with medical professionals. So they're getting that situated. But in the meantime, you're stuck with me. But, you know, I wanted to talk a little bit. Oh, it would help if I share my screen. There we go. About pharmacists and, you know, how historically they've been this hidden provider behind the scenes, but really it is time, and they are getting in the game. You know, in the past, this is a lovely little video where this is a physician who even talks about the pharmacist being this hidden provider that more and more is being integrated into a care team, because any drug that is administered to a patient is going to have, especially, well, prescribed, is going to have a pharmacist's involvement. And so when you are looking at the population that we have, it is aging, and many of the related problems that our elders experience are around their medications. You know, medication-related problems are actually one of the top 5 causes of death, and you know, major cause of confusion, depression, and beyond just these clinical issues, there is, of course, you cannot ignore the expense cost behind it. And so having a pharmacist involved on your care team helps reduce these risks, helps reduce cost, and is ultimately amazing for your patient's care. And so the bottom line when it comes to a pharmacist is no one knows more about medications than a pharmacist. Now, they're involved with many, really every step of the medication use process. And this is just a very quick overview from everywhere from selecting the correct medications to making sure they're stored and ordered and transcribed and dispensed correctly. One big piece, though, that I do not see here is also the counseling of patients, which more and more you are seeing pharmacists being that on that one-to-one, you know, with the patient, counseling them and helping guide on their medication regimen. So what does a pharmacist do? They advise not only the patients, but also the other healthcare professionals regarding prescriptions, over-the-counter, and even herbal products. They prescribe and administer immunizations, and this is a biggie, especially now. Our pharmacy students just this year have administered over 900 COVID-19 vaccinations in Anchorage and Matsu and in rural outreach locations, and we have more coming. Pharmacists are also your immunization experts. And so last year, not just COVID-19, but they administered the whole school 6,300 vaccinations across Alaska and Idaho. And those are, of course, your influenza, but also your tetanus and your other routine vaccinations. And then this counseling of patients, they are a provider, and so they can be one-on-one with patients. They can counsel them on use, but they specialize. So beyond just this image of a pharmacist behind the counter, there are actually more pharmacists located in clinical locations and even specializing in pediatric cardiology, even nuclear, which I think is absolutely fascinating. And so beyond providing drug information and drug interactions, they also do chronic disease and medication management. So your diabetes, your chronic disease patients, they can help with those. And my absolute favorite, I have children. Sometimes the medications can't be delivered in the standard way, and so they have to get creative. And so if you have a child, you probably know that strawberry or banana flavored medicine is going to go down a lot better. Mary Poppins definitely had that figured out. Now with our school, we're very lucky. Alaska and Idaho have some of the most progressive pharmacy practice laws in the country. That means when we're educating our students, we are educating them to practice at the top of their license, at the top of their game. So where do you work though? As I mentioned, most pharmacists are actually now in clinical settings, and you're seeing that grow. There is this perception that, oh, pharmacist jobs are actually reducing, but that is not the case, especially in Alaska. We've had a long need for pharmacists, and so we have this growth of pharmacists as they advance their practice of being placed in hospitals, nursing homes, even private practices as, again, a provider where patients would be scheduled with them.
1 minute left.
Okay, thank you. So they are one of the most trusted professions in the country, period, not just in healthcare. Now, nurses do beat them out, but they play a vital role in improving people's lives. And you can also have innovative and wide variety of career specialties. So we have a lovely little quiz to take a look at. It is part of the scavenger hunt. I recommend it, but think about whether or not pharmacy is right for you. Do you want to improve people's lives? Do you enjoy problem solving? Are you a good communicator? Are you detail oriented and like those sciences and maths? Well, you can start prepping in high school with some of your biology, maths, and when you get to the university, I can't stress this enough, start with your advisors. They should be your buddy every semester. You should be meeting with your advisor, but maintain your GPA and those prerequisites. But if you get a poor grade, just know it's not the end of your path. We can work and take a look, and you can always repeat a class if you do poorly. So don't let, as Kendra, Dr. Sticka told us earlier, failure be a roadblock. There are still paths forward. And then you can get experience as a pharmacy technician in this state, even without having a degree. So there's a pre-pharmacy club. I can't stress enough to get involved with them. And then once you're in the program, it's 2 to 3 years so you've got 2 to 3 years of prerequisites and then 4 years of pharmacy school. The first 3 are on campus here in our state-of-the-art facilities where we're connected to Idaho, but you're in class in person with your classmates. Your 4th year is out in the state, and then
We're at
to
5.
join with us because we're awesome. But yes, yeah, we're out of time, but if you have any questions, absolutely reach out to me, and thank you so much for being here.
Thank you, Chris, for hopping on and talking about the Doctor of Pharmacy program. Now we're going to hop back over to UW to hear from Jenny Fayette and Tim Olson about the MEDEX and Physician Assistant program.
Good afternoon, prospective students. I definitely agreed with Dr. Jackson there. Pharmacists are the best. They do a great job. And my COVID vaccine was done by one recently. So great job there. So I'm here today. I'm joined by my colleague, Jenny Fayette. We're both physician assistants. We are lecturers at the MEDEX Northwest PA program. And earlier you heard from our site director, Dr. Sturgis, and his very relevant conversation and presentation on imposter phenomenon. Along with our program assistant, Sandra Snedden, is also here today. So as you have seen, there's been many options for careers in medicine that have been presented, and today's summit is a wonderful way to explore these options. So I'm very glad to see it well attended today, and we get to do it in the comfort of our pajamas. So I think it's nice for me to enlighten you on the career as a physician assistant, or PA for short. So as we can see by this definition, a PA is a healthcare provider that practices medicine and treats patients, but works commonly as a team with other providers. The PA profession was actually created because there was a shortage of doctors in the 1970s. It was discovered that healthcare providers in the military had experience that could be expanded upon and provide excellent healthcare outside the military. So the role now has expanded to non-military health experience. And now PAs act as a primary health provider for millions of people in the US, including areas around the world. They diagnose and treat medical conditions. They interpret medical information. They prescribe medication. They suture, cast, splint, remove skin abnormalities. They're working in local clinics, emergency rooms, orthopedics, dermatology, cardiology, and many others. So MEDEX is a part of the University of Washington. And so similar to the Whammy program, partners with the UAA. And we have several campuses for training PAs all along the Northwest. MEDEX has a mission that matches what Dean Jesse stated earlier, which is to train a diverse population. This is why MEDEX has a campus in Anchorage. We want to train you to be able to provide healthcare for your local friends and family. So I think everyone can relate to the Alaska grown brand that we see walking around. So MEDEX, the road to become a PA is competitive and intense. It's about 2 years of training once you are in the program. Strong applicants will be locals or those in the military. They will also have prerequisites that are completed, and we'll talk more about those in a minute. But while in the program, you're going to earn a master's degree, and you'll have didactic classes for your first year. And then this will include coursework and multiple medical conditions. You'll have workshops on suturing and casting, and you'll have simulated mannequins for emergency medicine. And then second year, you will shift into hands-on learning in a wide variety of clinics, working with a preceptor to apply your knowledge. But your road isn't finished after that point. You will have commonly, you'll have to take your test, which is a national standardized test, and your degree will prepare you for that. And then you'll become a lifelong learner, which will allow you to continue taking these education requirements in the future. The benefit is that once you complete your journey, you will have a wide variety of environments to work in. So as we can see, they work in multiple different settings. They will be compensated well, and it's actually one of the fastest growing professions in the nation. So to get into school to be a PA, the MEDEX has specific requirements, and we can organize those by academic prerequisites and clinical prerequisites. So with all master's programs, there's certain courses that we'll need to prepare ourselves to be in this rigorous program. So these are the academic prerequisites. Now, commonly students will have completed a bachelor's degree in a science course, such as kinesiology, which was discussed earlier with TJ Miller. But this is not required. As long as you had prerequisites, you'll still be a good applicant for a PA. And separately, clinical prerequisites are matching with the foundation origin of a PA. So at MEDEX specifically, we have a requirement of a minimum 1 year or about 2,000 hours of paid clinical experience. Commonly, most students have more, and this is something that can be obtained in multiple different professions, such as working as an EMT or paramedic, medical assistant or scribe. Here at MEDEX, you'll see that our population is matching those of the surrounding area. So this is some statistics on our applicant pool from all of our campuses. We had a very large amount of applicants for a very small amount that are interviewed, and even a smaller amount that are accepted for 140 spots. But it's made up of applicants from the states within those campuses. They commonly have a military background. They have several years of experience, so usually more than just the one. And their GPA is high, but notice that it's not perfect, and it's taken into account multiple considerations, including your experience. And we have here lots of information that you can obtain from our admissions department. They have a great team that answers things very regularly. So a good starting point is there at that email address, MEDEX at University of Washington.
Kim, we can't see your slides.
Oh.
Can you forward to the last slide with the emails?
Yeah.
We're at 5 minutes.
Okay. I will forward the slides, but there is an email that you can use to provide any questions that you have prior to applying. Thank you.
And Jenny, why don't you take a couple of minutes?
I think he covered that all. I don't know, Tim, if you want to bring up the slide that shows that. The contact information. I'm actually a class 4 Anchorage graduate. And so I've been through the program myself, and I am more than willing to answer any questions in the chat box if anyone has them.
All right. Thank you both so much. Let's move on to the Doctor of Occupational Therapy program.
Hi, everyone. Nice to be with you today. I'm Dr. Carrie Moore. I'm the Academic Program Director for our Occupational Therapy program here at UAA. And similar to Whammy and MEDEX, we are a partner program with Creighton University out of Omaha, Nebraska. So in our few minutes together today, I want to just introduce you to the field of occupational therapy and then tell you a few things about our program specifically. So occupational therapy is one of the rehabilitative sciences. So similar to physical therapy or speech therapy, occupational therapists often work with individuals after they've experienced, say, a trauma or a significant injury, or in terms of pediatric clients, children who may experience a developmental delay or a neurobehavioral disorder. So in occupational therapy, we really do focus on the whole person. It is a very holistic approach to healthcare delivery. And occupational therapists tend to really emphasize what is important to the client as we're designing our treatment plans. So OT really is a profession that works with people across the lifespan. Oftentimes when I say I'm an occupational therapist, people assume that means that I help people find jobs. But as an occupational therapist, the word occupation to me means how people spend their time. So that can be hobbies, that can be just activities of daily living. So just to sort of present that word occupation really means things that are important and things that people need to get done in any given day. So OTs can work in a variety of practice settings, pediatrics, physical rehabilitation, neuro rehab, orthopedics, mental health. Similarly, occupational therapists are trained to work with a variety of individuals. So work-related injuries, amputees, prosthetics, individuals who've experienced a stroke or heart attack, arthritis, multiple sclerosis, similarly a traumatic brain injury. So really the field is really diverse, and there's lots of opportunities to sort of emphasize a particular practice setting and or area of expertise. So I'd like to talk a little bit now about the specifics of the OT program here at UAA. This is a hybrid program, meaning your lectures are delivered online by faculty members on the Omaha campus. And so you can listen to them live, like while the lecture is being given in Omaha, or most of our Alaska students, given the time change, do just watch those lectures at their convenience. So the lectures are uploaded just within an hour or two of when the lecture is given on campus. Those lectures are available on the course website. So your labs are taught here on the UAA campus, and we employ expert clinicians from the community to teach those lab components. And so you do have so say in the spring semester of your first year, you're on campus quite a bit. You've got 4 labs that are required in the curriculum in that semester. Also part of the program are our clinical education requirements. We do have national and international clinical sites throughout the country. We have a whole team that's dedicated to helping students kind of in this match process or selection process of where do you want to complete your clinical requirements for the program. We do have really an excellent pass rate on our national OT certification exam. Usually the program is really well known and highly respected, and our students typically do really well on that exam.
1 minute.
For the Alaska cohort, we accept a maximum of 14 students. So again, that ensures that really nice sort of cohort size. And again, given our in-person lab components, it really is a unique and valuable learning opportunity to be able to learn in a small group like that from an expert clinician. So there is information on the website. You can access information about the program either from the UAA website or the Creighton website. And also inquiries will come to me. So I'm happy to field any questions or clarifications that you may have. And thank you very much for your time. Enjoy the weekend.
Thank you so much. And thanks to everyone in our program panels today. What an excellent overview of some of the amazing programs that we have here.